How often do you have to use the bathroom? How frequently do you find yourself needing to urinate? Are you someone who can go several hours without urinating? Or are you someone who finds themselves who has to urinate every 20, 30 minutes, every hour? Well, if you don't know, using the bathroom to urinate every 2 hours is considered normal, up to about 4 hours. After that point, then we need to talk about maybe you're a bit dehydrated or why is your bladder retaining fluid and not able to release. But more often than not, what I tend to hear a lot of people say is that their bladder just can't hold much more liquid and they have to go to the bathroom frequently. And the poor bladder may not be the culprit. It may not be what's to blame. Instead, it could be your pelvic floor. Your pelvic floor muscles are known to help cut on and cut off the flow of urine. In order to cut on the flow of urine so that way you can pee, those muscles must relax. In order for you to stop the flow of urine or even hold your urine, hold your bladder, keep the pee in, then your pelvic floor muscles need to be able to contract. But what happens when you have pelvic floor muscles that are a bit more tense or tight and they don't know how to fully relax? What can happen is that you can have irritation at a tube in your body called your urethra. The urethra is the small tube that allows for urine to pass through. I'll show you here on a female pelvic model. On this pelvic model, right through here, you see we have our urethra. That urethra is where the urine will pass through. If you have the muscles around the urethra, so all of this area, if those muscles are tight, then what can happen is you can have constant pressure or tension along that urethra area. That can cause irritation and also present the urge to have to pee. So it may not be that your bladder can't hold the urine, but it may be that your pelvic floor muscles are overactive and doing way more than what they should. This can happen for a number of reasons, but I want you to do a quick body scan and body check. First, check and see, do you clench your jaw? Are you someone who gets frequent headaches because of tightness in your shoulders and neck? Are you someone who notices that you have hip pain or back pain? What about having tightness at your hips? Do you clench your butt at all? If you answered yes to any of those questions, then you may have pelvic floor tension. And those are all things that we can address so that way you can make sure that you're decreasing the tension at the pelvic floor. Because if those pelvic floor muscles are tight, then it can make activities such as relaxing so you can pee when you go to urinate very challenging. And if you're not able to fully relax when you pee, not only will your body not allow for you to do that, but you also can start to retain urine in some cases. So that can also lead to the urgency to have to go more frequently simply because your bladder did not fully empty. So what can you do about that? Well, one, you can learn how to properly breathe. So we've gone over before diaphragmatic breathing, so that way you can learn how to actually sense and feel your pelvic floor, allowing for that pelvic floor to fully drop down and expand as you take that breath in. You can also work on simply unclenching your jaw, using the tip of your tongue just behind the teeth, so that way now you can keep your jaw in a relaxed position. If you're someone who grinds their teeth or wakes up with a super stiff jaw, then you may want to talk with your medical provider to see if getting some type of mouth guard at night is beneficial for you. Because if you're clenching down all night long or even throughout the day, that can cause direct tension on the pelvic floor as well. Now, if you notice that you have tightness in your neck or your shoulders, then consider adding more stretches in, especially if you're sitting down a lot. Because when we sit, we tend to end up in a slouch position, which is going to put more tension and pressure on our cervical, our neck, that's our cervical spine, and also on our shoulders, which will impact your pelvic floor. So you can also simply do another body scan and say, oh, unclench. So what do I mean by unclench? I mean, let go of your butt. If you're someone who squeezes their butt and you don't even realize it, go ahead and quickly shake out the legs and also work on occasionally reminding yourself to unclench throughout the day. Now, there's one other factor that's directly related to pelvic floor tightness that I have not mentioned yet, and that's stress. So figure out what stresses that you have that you can minimize and also develop coping strategies to better overcome. Stress in itself can be a direct link with pelvic floor tightness and dysfunction. If you didn't notice, I want you to start taking note as to when your urgency increases. Because for some people, it increases when they are stressed or have a lot of different activities going on. So take time to breathe to mitigate some of the stress. Figure out what you're able to let go if you're able to do that. Also, work on coping strategies because I wish we could eliminate stress altogether, but unfortunately, we cannot. So addressing these different factors when it comes to the tightness of the pelvic floor, that can be really beneficial in improving your urgency symptoms as far as how frequently you have to pee. So remember, unclench your jaw, focus on deep breathing activities, do stretches for your neck and for your shoulders, unclench your butt, and also figure out what you can do to help mitigate and decrease your stress levels. So if you're someone who has urgency, give those a try and let me know how they're working out for you.